Good afternoon, everyone. Thank you so much for joining us. My name is Judy Blake. I am the Leadership and Advocacy Coordinator for Family to Family Network. So happy to be bringing you another Wednesday training today. I am very fortunate to be joined by a couple of my colleagues as well, who I want to introduce. Christina Zavala.
Hello, everyone. Welcome, and thank you for joining.
Could not do these programs without Christina. I also want to welcome Leslie, who was not having a good hair day, but if you want to say a quick hello, Leslie.
Hi, everybody.
Leslie is one of our parent liaisons. She's been with Family to Family Network since the beginning of time, and we could not do our job without Leslie. So some of you may know her. And one of our newest members is Inger Clark. And Inger is waving there. So Inger is running a very cool program. Inger, why don't you take just a quick minute and explain what your program is that you are doing with Christina?
Oh, it's a great opportunity to help parents to get prepared for the future. It's financial, and it's for anyone. It's not just for parents who have children with disabilities. It's for everyone. So we hope that you will go onto our website and register for the program. It's going to be awesome. I'm ready.
Yes, you are.
What about you, Christina?
Yes, we are starting.
They are. So it's really going to be great. You know, one of the things that we always talk about at Family to Family Network is having a plan. Because if you have a plan, I think you feel a little bit more secure. You feel more empowered. You're able to advocate for your loved one and then pass on those advocacy skills to your loved one. So we are very, very happy today to bring you Kenyonika Johnson. Kenyonika is the program director at the Harris Center for Mental Health and IDD, and she coordinates a wonderful program called Community First Choice. Community First Choice is a terrific program that a lot of people don't realize, and it allows for young adults like my son to receive services while they are on the interest list, those never-ending interest lists that we all talk about. If you're not sure what the Medicaid waiver interest lists are, CLASS, HCS, Texas Home Living, if that doesn't even ring a bell to you, please reach out to us at Family to Family Network. We will explain to you what those interest lists are. A couple of housekeeping notes. Please make sure that you're on mute. If you could also please hold your questions until the end, but if there's something that you think you may not remember, go ahead and type it in the chat box. We will make sure that we get to as many questions as possible, and if for some reason we don't have time, we will make sure that we get an answer to you. We want everyone to know that this is a really safe space. No question is silly. No question is ridiculous. Everyone has the right to their opinion, but we always want to be respectful of everyone's opinions. So, Kenyonika, I'm going to have you go ahead and share your screen. I have been waiting for you to join us forever and a day, so it's really exciting that it's finally here.
Thank you, Judy. I'm excited as well. Thank you for having me.
My pleasure. Go back to your, there you go. Perfect.
Yes. Okay, so as Judy mentioned, my name is Kenyonika Johnson. She often refers to me as the CFC Queen.
Yes, that is correct. You are the CFC Queen, you're right.
Thank you, Judy. But my official title is Program Director. I'm a Program Director for Community First Choice Service Coordination with the Harris Center. So I essentially have oversight of the service coordinators for individuals who are already enrolled in the Community First Choice program. And the purpose of my presentation today is to help the community have a better understanding of what Community First Choice is. So for today, I will be covering the following objectives. A little bit of information, background history information about CFC, when, why, and how it was started. I'll also be talking about the impact that it has in various programs. I'll also be going over the eligibility requirements for enrolling in the Community First Choice program, as well as the services that are offered through CFC and the settings in which families can receive them or individuals can receive them in. I'll also be discussing what the functional assessment is, the purpose of it, and who completes it. I'll go over the role of the local IDD authority or LIDA, which is where I work, as well as other entities such as Health and Human Services Commission, HHSC, and the Managed Care Organizations or MCOs. I will also be sharing what the enrollment process looks like for people that are interested in enrolling in the program. I'll be providing a little bit of information or feedback as it relates to some commonly frequently asked questions that we have received. And then last but not least, I will be sharing information, resources and information on how to access CFC services if you are interested. So how it all started. Community First Choice was birthed from Senate Bill 7 from the 2013 Texas legislature, which basically stated that the state of Texas needed to develop a cost-effective way to deliver basic attendant and habilitation services to the community. So as a result, Health and Human Services Commission was able to meet this requirement by implementing Community First Choice services as a new state plan benefit. And the goal of this cost-effective approach was that ultimately it would generate an additional 6% Medicaid revenue. So it would increase the revenue for Medicaid. Once the details were ironed out for Community First Choice, the program began on June 1st of 2015. So in what ways can Community First Choice be received? The most common way that we see it requested and received right now is through the Medicaid Managed Care program. And this is by where an individual is enrolled under the auspices of a managed care organization, and they're receiving services at a capitated rate. It's also available to, also has been known to be available to people that have traditional fee-for-service Medicaid, which is pretty much the exact opposite of what Medicaid managed care is. These services are rendered to individuals in an unbundled capacity. Community First Choice is also now offered under the 1915C IDD waivers. And as Judy mentioned in her introduction, a couple of these waivers, and that's commonly known to the LIDA, is the Health and Community Services, Health and Community, Home and Community-Based, I'm sorry, I'm getting all my words tied up.
Don't you
I
worry.
apologize. Home and Community-Based Services or HCS program, as well as the Texas Home Living Waiver Program. These are excellent programs for individuals with IDD or related condition. If you have not heard of them, like Judy said, I would strongly recommend that you do your research. If you know of someone that has IDD or suspect to have IDD or related condition, I strongly encourage that they be placed on the interest list for these services. They offer a wide array of services to individuals with IDD once their name comes up on the interest list. Those services range from nursing, dental services, day habilitation, behavior supports, physical therapy, employment services, and the list just goes on from there. HCS, unlike Texas Home Living, also offers a residential model. So that's where they pretty much differ. HCS has residential components. So these services both, as I mentioned, offers Community First Choice components as well. But because the waiting list is so long, Community First Choice is a great option in the non-waiver sector while individuals are waiting to be waiting for their slot for the IDD waivers. Community First Choice is also potentially offered in other waiver programs, and some examples of those would be the Medically Dependent Children's Program, or MDCP, the Youth Empowerment Services Waiver Program, or YES Waiver Program, and STAR Plus Waiver Program. So it may not necessarily be called Community First Choice under those programs, but they're CFC-like programs that could be potentially be offered through those as well. However, for the sake of today's presentation, I will be focusing primarily on what Community First Choice looks like in the Medicaid managed care model. So who qualifies for Community First Choice? All ages can potentially qualify. There's no minimum or maximum age for an individual to participate in the program. However, the individual that is requesting services must be a Medicaid recipient. So they must have Medicaid benefits in place. Because remember, the goal of this program is to draw down additional Medicaid revenue. So Medicaid is a requirement, and unfortunately, private copay is just not an option for Community First Choice. A person requesting Community First Choice must also need assistance with their activities of daily living skills, or ADLs, and or their instrumental activities of daily living skills. And so the activities of daily living skills are your basic self-care skills, such as grooming, bathing, dressing, toileting, whereas the instrumental activities of daily living skills are your more complex skills that are needed to live a more independent life, such as shopping, meal preparation, money management, laundry, and things of that nature. Also, to qualify for Community First Choice, an individual must meet what's called institutional level of care requirements. And we will talk a little bit about what that looks like and what that means in just a minute for the IDD population. It is possible that a person could qualify for Community First Choice if they have a medical condition. So based upon medical necessity, they could qualify to receive CFC services. And that eligibility is determined by state agencies. So what does institutional level of care mean? It essentially means that the person is diagnostically or functionally eligible to receive services in any of these settings: a hospital or nursing facility, an institution that provides psychiatric services for anyone under the age of 21, or an individual 65 and older, an intermediate care facility for individuals with an intellectual disability or related condition. So for the population that we're discussing in today's presentation, they would have to qualify to receive services in an ICF institution. The level of care is determined by the local IDD authority, or LIDA. Part of the process for intake to IDD services at the LIDA is that a diagnostic eligibility assessment has to be completed for everyone that's requesting services. This is completed by a licensed psychologist or a certified assessor. Once they complete this assessment, they compile the results in what's called a determination of intellectual disability, also known as a DID or DID report. This report, the information that's in the DID report, then yields the results as to whether a person would qualify for level of care. I'm sorry. Below, you'll see the breakdown of this. So for an individual with IDD to qualify for placement in an ICF and ultimately in the Community First Choice program, he or she must qualify for a level of care 1 or a level of care 8. Level of care 1 means that the person has IDD with an IQ of 69 or below, and they also have a mild to extreme adaptive behavior level. To also qualify for level 1, it could be an individual with a related condition, such as autism. He or she must have an IQ of 75 or below with mild to extreme adaptive behaviors. And for the level of care 8 requirement, an individual must have a related condition and moderate to extreme adaptive behavior levels. So between the two, the level of care 1, level of care 8, you'll see that level of care 8 only refers to those that have, or primarily refers to those that have a related condition, and IQ is not necessarily a factor. So what services are offered in the Community First Choice program? Oftentimes when you hear of CFC, you often probably hear CFC Pass Have. And so it's probably easy to assume that only 2 services are available through the program. However, there are 4 services that can be selected under Community First Choice. Personal Assistance Services, PASS, Habilitation, HAB, Emergency Response Services, ERS, and Support Management are the 4. It is important to note that only PASS and HAB components are calculated in a person's authorized hours for Community First Choice. So let's talk a little bit about what each of these services are. For personal assistance services, this is essentially a paid attendant that's doing the task for the individual. They provide assistance with that person with their basic living skills or their complex living skills through hands-on support, supervision, or cueing. So typically, if an individual is not able to do specific tasks, the paid attendant can be hired to do these tasks for them, and it can range from their basic to complex living skills. It is delivered to them on a person-centered basis, meaning that it's individualized. It's dependent on what that person needs. There's no prescriptive number or prescriptive way of how attendant services has to be delivered. Some unique ways that PASS could also be authorized under Community First Choice one is with household chores. So if an individual is unable to maybe keep their living environment clean, a paid attendant can come in and make sure that their living environment stays clean, it's sanitary, it's safe. It's not necessarily a service that will clean a family's entire home if the individual lives at home with his family, but the paid attendant can make sure that their room, their bathroom, and things like that are sanitized and safe for them to use. Personal assistance services can also be used to conduct what's called escort services. This is essentially where the attendant will accompany, not transport, but go with the individual to access certain activities in the community. So an example of that would be shopping. If they have a doctor's appointment, they can accompany them to their doctor's appointment to make sure they're checking in, checking out okay. Money management, if they have a bank account and maybe need to visit the bank. Those are just some examples of how the escort services can be utilized. And then lastly, another unique way that we have seen personal assistance services authorized is the assistance with health-related tasks. So if a person maybe has a health condition, maybe be a diabetic or something like that, and there are things that a registered nurse could delegate to the family could have the paid attendant complete those tasks for the individual. So any health maintenance activities, any extension of therapies, if they receive physical therapy in the community and there's some therapy exercises that they may need to continue to do at home, the paid PASS attendant can help with that as well. Habilitation services is essentially training. So this is a little bit different from PASS. PASS, the attendant is actually doing the task for the individual. Habilitation, the goal is to train the individual, and it's for any individual, no matter what their level of functioning is. They help the member acquire, maintain, and enhance their skills, both their basic and complex skills. It could also be health-related skills. But the ultimate goal is to teach the individual how to do the task rather than doing it for them. This is interesting too, because a lot of people assume that, if habilitation is authorized and they probably can't utilize personal assistance services. But depending on the task, personal assistance services can also be authorized for specific components. And I'll just give you a couple examples of what that may look like. If an individual wants to learn how to dress himself, the attendant may start out with teaching them how to put on their shirt. So they're being trained on how to put their shirt on, but they may not necessarily be at the level where they're ready to actually button the shirt or zip the shirt up. So pass could be authorized for that portion where the attendant is actually doing the zipping or buttoning the shirt up for them. Another example with complex living skills, laundry. That's a common one that we see. The individual may want to learn how to do their own laundry, but at this point, they're only able to handle being trained on sorting their laundry. So they may have a habilitation authorized on the sorting portion, but pass is authorized to measure out the detergent, to actually operate the machine, the other tasks that's related to doing laundry. Emergency response services. So when I explain this one to families, I kind of remind them about the whole life alert commercial. I know many of you may have seen it where you see the elderly person, she falls and she's unable to get up and she's able to push a button on her life alert and alert EMS that she's hurt herself. Emergency response services operates very similar to that. It's an electronic device that's worn by an individual. When it's activated, it actually alerts a designated person. It won't alert 911 or EMS, but it alerts whoever the designated person is and lets them know that that individual is experiencing some type of emergency. This service is not very commonly requested with CFC. However, it is a great service for members who require extensive supervision, someone that may have a health condition but lives alone. It may be someone that lives with their family, but their family works or goes to school, and so they're left alone for significant parts of the day. But all in all, it's a great option for anyone that doesn't have regular caregivers for an extended period of time. Support management. So support management is the least commonly requested service under CFC services. And that's probably primarily because most families, by the time that they're reaching out and they're asking for community first choice services, they already have in mind who they want their CFC attendant to be. And so they may feel comfortable that they can manage that. However, for families that do not, this is a good service to ask for. It's a one-time voluntary training. The MCO provides some tips on how to select, manage, and dismiss their attendants. And this service is offered to all members regardless of their service delivery model. So in speaking about service delivery models, what exactly is that? You probably have seen these very often with other programs. It's not just tied to community first choice, but there are two options when it comes to service delivery. You have the agency provider option and you have the consumer directed services option. The agency provider option is the most commonly selected option. This option allows the services to be provided and managed by a provider who's contracted with the managed care organization. And so the managed care organization hands the family a list of providers, and the family is responsible for selecting a provider from that list. Once they have a provider in place, that provider handles everything from background checks. If the family doesn't have an attendant in place, they're going to make sure that an attendant has been assigned. They supply backup attendants if their attendant needs to be out. They make sure that the attendant is clocking in, clocking out appropriately, they're getting paid, things of that nature. So the only responsibility of the family is being able to select a provider under this option. And if they have their own attendant in mind, just sharing that information with the provider so that they can get paperwork set up for their attendant. Under the consumer directed services option, this option gives the family a little bit more power over how their services are being delivered. There is no provider agency in place under this option. So therefore the family is responsible for the hiring, the managing and dismissing of their attendants. They're ultimately responsible primarily for all the things that I just mentioned under the provider agency option. They will have the support of what's called a financial management services agency, or FMSA. The FMSA will assist only with financial aspects of the service delivery, such as payroll, and maybe filing income taxes. So this is a good option if families, want to have a little bit more involvement, want to be able to self-direct their services. I do hear that some of the benefits under this option is that families may have more flexibility over the pay. They're able to maybe offer a little bit better pay for their attendant, and they have more flexibility over the attendance schedule. However, under this option, only PASS, HAB, and support management are available. You'll see under the agency provider option, all 4 services are available, but ERS is not an option under the CDS option service delivery model. And I think that's probably because there's no provider agency in place to actually supply the device. However, I have been informed that if a family chooses CDS and they also need ERS, then they can potentially contact Medicaid to request that. It's important to note under the CDS option, because a lot of parents of adults decide that they want to be the paid attendant for their child or their adult child. Under this option, the parent cannot be the paid attendant and the CDS employer. So that's just something to keep in mind. If a family chooses this option, they'll need someone that's the actual CDS employer if they're planning to be the paid attendant. So although the presentation today is primarily focused on receiving community first choice in the non-waiver or MCO managed care sector, I wanted to show this because I know a lot of people are on the interest list. They're waiting for those HCS and Texas Home Living slots to open up. And I felt like this would be really good, a good way to kind of give families a sense of security to know that there's not a whole lot of difference in the service delivery in the waivers versus the non-waiver sector. So you'll see under the 1915C IDD waiver sector that services are provided to an individual, and this includes community first choice, through a comprehensive waiver provider. This provider is contracted with the Health and Human Services Center. Under this option, the family still has the option of agency or service delivery model, or the CDS model as their service delivery. So those are still options available to them. Also, the LIDA service coordinator completes the functional assessment in the waiver, and they provide what's called ongoing targeted case management. So that means that they're monitoring these services on an ongoing basis. The LIDA service coordinator, once they complete the functional assessment, that assessment is sent to the waiver provider that the family has selected. That way the provider knows exactly what tasks are being requested under community first choice. So you'll notice under the non-waiver community first choice chart, it's pretty similar. There's a couple things that are a little bit different, but CFC services are provided through a CFC provider. This provider is contracted directly with the managed care organization. So it's not, they're not contracted with HHSC, it's the MCO. Again, you have the option of agency or CDS service delivery. Also, the LIDA service coordinator conducts the functional assessment under this model and ongoing monitoring or targeted case management. However, it's only for individuals aged 21 and older under this model. And we'll get into a little bit more detail about that in just a moment, because I know that gets pretty confusing. Lastly, the functional assessment that's completed by the LIDA service coordinator is sent to the managed care organization. The managed care organization then forwards the assessment on to the contracted provider so that they are aware of CFC services that are being requested. So let's talk about service settings. Where can CFC be provided? This has been somewhat of a controversial topic because, I've often heard that people say that CFC cannot be provided in the community. It literally has to be provided in the individual's own home or family home. And I think the confusion comes from the fact that it's stated that all CFC providers all CFC services are provided in a community-based setting. A community-based setting is an individual's own home or family home. What this simply means is that a person must be residing. When they're requesting community first choice services, they must be living in their own home or family home. However, it doesn't mean that every single task that's authorized under CFC has to be provided literally in the home. There are some community tasks such as shopping and money management and other things like that that obviously has to be delivered in the community. However, community-based settings does not include any of the following: nursing facilities, hospitals, institutions for mental disease, intermediate care facilities for individuals with IDD or related condition, or any setting that has a characteristic of an institution. So if anyone is living in any of these settings, they are not eligible to receive community first choice services. However, it is important to note that we understand from time to time individuals are hospitalized for various reasons. And if they're enrolled in community first choice, those services can be temporarily paused until they are discharged from the hospital. So what is the functional assessment and who completes it? The functional assessment is essentially an assessment that's performed to determine what the individual is capable of doing, what he or she is not capable of doing, and what he or she wants assistance with. It is always a person-centered process, meaning that it's individualized, it's based on that particular individual needs. And these assessments are completed by various entities. It just depends on the member situation. So if you look at the chart below, I kind of break it down by the managed care plan. If an individual is enrolled in the Medicaid Star Plus managed care plan, then he or she is age 21 and up, and the LIDA is responsible for completing the functional assessment. If an individual is enrolled in the Star Kids managed care plan, he or she is under the age of 21, so they're considered a minor, and the managed care organization completes their functional assessment. And then lastly, if an individual has Star Medicaid managed care, he or she is also under age 21. However, in this situation, the Department of State Health Services, or DSHS, is responsible for completing the functional assessment. So what's the role of the LIDA in all of this? The LIDA is responsible for conducting the determination of intellectual disability report that was mentioned earlier. This is part of the IDD intake process. So if a person approaches us and they're interested in community first choice, and they do not have this in place, this is the first step. They have to have a DID in place. Once that has been completed, the LIDA is responsible for completing what's called an intellectual disability related condition assessment, or IDRC. This assessment helps the LIDA determine, or helps the LIDA submit the information to determine if a person meets level of care 1 or level of care 8. This information, the DID and the IDR assessment, are submitted to HHSC for review. Once a response is provided back to the LIDA is responsible for communicating the level of care results to the MCO or DSHS. And I also thought it was important because the adults versus minor thing is very, very confusing in this non-waiver sector. So I included this chart here just to kind of show you details of the LIDA's responsibilities if a person is under 21 versus if they're 21 and older. If an individual is under the age of 21, the LIDA must provide the family with the results of the level of care results. The LIDA is also responsible for following up with the individual to make sure that their MCO or DSHS has made contact to complete their assessment. So remember, under those Medicaid managed care plans for minors under the age of 21, functional assessment has to be completed by the MCO or DSHS, depending on what type of plan they're in. Once that contact has been made, the LIT is responsible for closing the case, and if there's additional service needs, the LIT is responsible for referring the family on. If a person is age 21 and older, the LIT is responsible for developing the CSC functional assessment. Well, let me back up just a moment, but the LIT is also responsible for providing the family with the level of care results. So it doesn't matter what the age is, we're still responsible for letting the family know if level of care has been approved or denied. And assuming that it has been approved, or once we receive an approval, then the LIT is responsible for completing the CSC functional assessment for those 21 and older. The LITA is also responsible for making sure that they collaborate with the MCOs on the CFC functional assessment, and that both the LITA service coordinator and the MCO service coordinator agree to the functional assessment. And once that's done, the LITA is responsible for jointly meeting with the family to present the results. And then last but not least, once a person's enrolled, they are provided ongoing targeted case management by the service coordinator. So the service coordinator is making contact most likely once a month, face-to-face, and then they're making some follow-up calls with the family to make sure that the individual's goals and outcomes are being met. So let's talk about roles for other entities, the managed care organization and HHSC. The managed care organization is responsible for referring individuals with or suspected to have IDD to the LITA if they're in need of IDD services. They're also responsible for maintaining a network of credentialed providers who are capable of providing PASHAP services. The MCO is ultimately responsible for authorizing services. So although the LITA for adults age 21 and older completes the functional assessment, services ultimately cannot be authorized until the MCO does that. They're responsible for that part. And then the MCO also provides some level of service coordination. Part of that includes helping the family access providers, also access resources that they need. And as mentioned earlier, if they're under the age of 21 and enrolled in CFC, the MCO is responsible for monitoring those services. HHSC is responsible, Health and Human Services Commission, they're responsible for having contract oversight with the MCOs, having contract oversight with the LITAs, authorizing determination of the level of care criteria. So although we train our service coordinators to be able to look at the DID report and they can pretty much tell, almost immediately whether a person qualifies under level of care 1 or 8, the actual approval or denial has to come from HHSC. And then lastly, HHSC is responsible for facilitating a fair hearing process if a level of care happens to be denied. So let's take all of these roles and kind of bundle them together or lay them out, I guess I should say, in this illustration so that you have a pretty good idea of what the enrollment process looks like if a person is an adult age 21 and up. Let's also assume that this person already has a DID in place. They've contacted their managed care organization and said, hey, I've heard about this great program. I'm interested in enrolling. The MCO will send over a referral to the LITA. The LITA will then assign a service coordinator to that individual. The service coordinator is then responsible for meeting with the family. They're holding an initial meeting. At this initial meeting, they're completing the IDRC assessment so that they can request a level of care approval. They're completing agency consent forms. And again, as mentioned, because the service coordinator pretty much knows if a level of care 1 or 8 will be approved, many of them will go ahead and start completing the CFC functional assessment. And that's mainly because this is a 21-page assessment. It's really, really long. And sometimes it does take multiple meetings to complete it, but we do try to get a head start on it so that we could get people into services a lot faster. The IDRC report is sent to HHSC for approval. And once we receive that approval, the level of care approval. The level of care approval, along with the functional assessment, is sent to the MCO for review. As mentioned earlier, the MCO service coordinator, the LIDA service coordinator, they review the assessment together, they come to an agreement, and then a second meeting takes place with the family. At this second meeting, the final assessment is presented to the family, and the family and everyone at the meeting signs off. Also, if it has not already taken place, a lot of times the provider list is provided to the family at the first meeting, or we request for it to be sent. It has to come from the MCO. At this point, a provider is selected, a provider that's contracted with the MCO. Once a provider has been selected, the MCO is then able to authorize services and CFC services begins. Once services are in place, again, because this person is age 21 and up, the LIDA service coordinator is responsible for monitoring their CFC services. So let's take a look at what it looks like if the individual is a minor. So a minor in Medicaid managed care is someone that's age 20 and under. And assuming the same situation, let's just assume they have a DID in place, they've contacted their MCO, requested CFC. The process pretty much looks the same. The referral comes to the LIDA assigns a service coordinator, and an initial meeting is held with the family. At this particular initial meeting, only the IDRC to request the level of care and agency consents are completed. Because remember, this person is under the age of 21, so their MCO or DSHIS is responsible for completing that CFC assessment. So you'll see here, once the level of care has been approved, that's when the MCO and DSHIS, they're notified and they're given the green light to go ahead and conduct the CFC assessment. We here at the LIDA, we try to keep the case open for at least 30 days. Sometimes it's a little bit more, but we want to make sure that the MCO and DSHIS has made that contact and the ball hasn't been dropped. Once we confirm that, the CFC service coordinator with the LIDA discharges the individual. And like I said earlier, if there's other service needs in the community or even within the LIDA, we move forward with that referral. And because the person is age 20 and under, the MCO service coordinator monitors their CFC services. So I added this information here, and maybe this will answer some of the questions that you have today. But these are some common questions that we've run across, and I thought it would be interesting to share. For non-waiver CFC recipients, so CFC participants through the MCO, the attendant can live in the home with the individual, as long as the individual is at least 18 years of age. So if they're a parent of a minor cannot be the paid attendant. If they're under the age of 18, they will have to find someone else to be the attendant. Also, the spouse of a participant, someone that's enrolled in CFC, if they're married and they have a spouse, the spouse cannot be the paid attendant. I didn't include this earlier, but it's probably important to say, once a person enrolls in the waiver programs, HCS or Texas Home Living, it is different. Even if the individual is over 18, the paid attendant cannot live in the home with the individual. If a person is receiving community first choice services, he or she is also qualified to receive what's called general revenue services. And these services are state-funded services. They're funded through the LIDA. Some examples include respite, behavior support, day habilitation. It just all depends on what that particular LIDA has available to offer. But they can certainly receive general revenue services along with community first choice. Community first choice cannot be provided along with other attendant care services. So if a person receives something like personal care services, they cannot receive both. Oftentimes we get families that contact us and they assume, well, I have 15 hours on the PCS services. I'm wondering, will CFC qualify me for additional services? And they cannot be received together. mainly because it's a duplication of services and potentially double dipping in terms of funding. Community First Choice Services does not affect anyone's HCS or Texas Home Living interestless states. So this is another rumor I'd like to dispel, because some families are fearful for trying CFC out, thinking that it may delay their enrollment in the HCS program or Texas Home Living program, or it may even take the place of them being offered HCS, Texas Home Living. This is not true. A person will remain on the interest list even though they're enrolled in CFC. As mentioned earlier, once they are enrolled, their name comes up on the interest list, CFC can continue to be provided under HCS and Texas Home Living. So all in all, Community First Choice is a great plan benefit. It offers a great option for people with disabilities while they're waiting on the IDD interest list for services. So again, if you haven't heard of it, I strongly encourage people to do their research, contact their local LIDA, and get on the interest list. You don't have to come in for intake with the LIDA to be placed on the interest list. You can simply make that call to be added. And then last but not least, and probably most importantly, Community First Choice is an entitlement benefit. So that means there's no waiting list, there's no interest list for the services. These services can be requested at any time. How can a person access services if they're interested? They can simply, if they're enrolled in any of these plans, Star Plus Medicaid plan, the Star Kids managed care plan, or the Star Health plan, they can contact their managed care organizations at these numbers. And I'll also share this information after today's presentation. Here in Harris County, we are served by the following: United Star Kids and Star Plus, Molina Star Plus, AmeriGroup Star Kids, AmeriGroup Star Plus, Texas Children's Health Plan, and Superior. If a person has Star benefits, the process is a little bit differently. They would contact Texas Medicaid and Healthcare Partnership, or the TMHP client line, at this particular number. And once they contact them and express an interest for Community First Choice, the referral is routed over to DISHES, who then routes the referral to the LIDA. And because this is a lot of information, a lot of phone numbers, and I know sometimes it may be difficult to get in with the MCO, or parents or families just get confused about the plan that they're under and who to call. You can always encourage families to contact their local LIDA. If someone contacts us and they haven't contacted their MCO or the TMHP client line first, we don't turn them away. We assist them with making that contact. And then lastly, in terms of resources, if someone in the Harris County area is in need of services, they may contact our eligibility center at this following number, 713-970-3973. That's our intake unit, and they'll get everything set up and scheduled. If you have additional questions related to Community First Choice and specifically service coordination, maybe you have someone that's enrolled or they're currently enrolling in the program and you have specific questions, you can always reach me at 713-970-7649 or by email at kenyonika.johnson@theharriscenter.org. And then last but not least, if you're interested in just more general information about the program, this link here is pretty long. So I would just recommend that you go to HHSC's website, which is hhs.texas.gov, and then in the search engine, type in Community First Choice. And I want to thank everyone for their time and joining in. I hope that this information was valuable to you and that you have learned something. And if there's something that you recommend that I include in this going forward, I'd be grateful for that feedback as well. But I am open to questions at this time. Thank you.
Kenyonika, thank you a million. If you want to stop sharing your screen, as you can imagine, We have lots of questions. Huge compliments for you. This was great information. People have
Awesome,
sent
thank you.
private messages. So for those of you on the call who, we have a bad habit in this industry, and I do the same thing of, all these different abbreviations. So ALITA is the Local Intellectual and Developmental Disability Authority. And the, Suresh, I see your hand raised. If you could go ahead and type your question in the chat box. If you could, that would be great. So if you live in Harris County, your local LIDA is the Harris Center for Mental Health and IDD. It would be Kenyonika. If you live in Fort Bend County, it is Texana. If you live in Montgomery County, it is Tri-County Behavioral Health. If you live in Galveston, League City, well, I don't know about League City, but definitely Galveston, it would be the Gulf Coast Center. So you can definitely reach out to us, or you could even Google who is my LIDA in Texas, and it will tell you all of them, and it goes by county. So if you have to leave us, because I want to be respectful of everyone's time, Christina, if you could post the survey link in the chat box another time, that would be great. So let me go ahead and start with the questions, and I'm going to go in the order for which they were received. It sounds like a recording. Also, for those of you, a couple of you had sent private messages. If you would like a copy of the recording or this presentation, please remind me. Just email me at judy@familytofamilynetwork.org, and I will go ahead and send it to you. Okay, first question was,
Judy, while you're looking, if I may ask a couple questions that I got.
sure,
Okay.
yeah, go ahead. I just found
Okay.
it, but go ahead.
Thank you. One of the questions is if job coaching falls under any of the programs that on CFC, like under habilitation or anything like that. If it covers employment prep.
So unfortunately, there is no employment assistance component under Community First Choice. It may be some options to work on certain skills under interpersonal skills and things like that that may be useful for interviewing or something like that. But to say that there's an employment services component, unfortunately, it's not with Community First Choice, but that is one of the options with the waivers.
All right.
So if I
Thanks.
could just interject on whoever asked that question, Christina, what they can do is reach out to Texas Workforce Commission, to their VOC rehab counselor. They can request supported employment through that VOC rehab counselor. And if they have questions on that, have them email us.
Sure thing. Thank you.
That's how they can get that support.
Thank you.
Any other
Kenyonika.
questions, Christina?
Well, I had one more. Does CFC cover employment? No, we already done that. Is CFC also for the elderly at any point, with or without a disability?
Yeah, absolutely. So there is no age limit for Community First Choice. And people that may not necessarily have IDD or related condition could potentially qualify under medical necessity. So if an elderly person has a medical condition, they certainly possibly would qualify. I would encourage them to contact their Medicaid.
Great to know. Thank you.
Thank you.
That's it, Judy.
Thank you. I got a couple of private messages. So for a child, if they are not on Medicaid, does someone have to be on Medicaid in order to receive CFC?
And I'm assuming that the child is the recipient of services?
Yes, correct.
Okay, so unfortunately, the child has to have Medicaid
Right.
services to receive Community First Choice. So even though it may be someone else in the home that receives those benefits, it has to be the CFC participant that has the Medicaid in place.
Okay, so Christina, in answer to your question, even like if it's an elderly person, does it help if they're on Medicare, Kenyonika, or you're not sure on that one?
I'm not 100% sure on that one.
Okay,
I would encourage them to call
okay,
and just inquire because obviously we don't enroll people based off medical necessity. So there may be some workaround for elderly.
Perfect. First question, and no question is dumb, do not worry. My kid is turning 18 next week. He receives personal assistance services, PASS, through MDCP Medicaid. For those of you who don't know, MDCP is another waiver, medically dependent. Am I correct that CFC is essentially the adult version of what he is getting? Second, do I need not worry about this until he's 21?
The
And
answer
Kenyonika,
to,
we don't expect you to have all the answers.
well, I think I have the answer to these.
Okay,
But the answer to both is yes, that is the adult version. CFC would be the adult version they're receiving. And yes, to their second question. So they would wait until they age out of the program and then they could request community first choice.
perfect. Thank you. Next question. You mentioned about CFC and the attendant can escort them to certain services, but they cannot transport them. So Barb had a great question about taking an adult to the grocery store. You mentioned that PASS can escort or accompany, but not transport. So who can transport a person with a disability if they cannot drive?
So the attendant can actually take them, but the difference is they won't be able to bill for escort service.
Oh,
So,
I see. So they can
yeah.
physically drive them.
Ex-
You just can't bill for mileage and things like that.
Exactly.
Okay.
So if you're
Okay.
billing under the escort task, then you have to actually be escorting or accompanying the individual. So an example of that would be maybe somebody that uses the bus as their transportation, but may want their attendant to kind of tag along with them for whatever reason. So that's where you kind of see the escort being utilized a little bit more, but that one is very seldom requested or used simply because it restricts the attendant from being able to transport. So if an attendant is going out in the community, maybe helping an individual do their shopping,
Right.
They can certainly transport them. They just won't bill for the transporting part of it.
Perfect. Thank you.
You're welcome.
Are CFC Medicaid funds from the Affordable Care Act, Obamacare? I didn't think they were.
I don't think so either, but
Yeah.
I'm not 100% sure on that one.
Yeah, because CFC has been around long before Obamacare. I have Obamacare.
Yeah, I'm not sure. It
Yeah.
may be tied to the Affordable Care Act, but I'm not 100% sure on that.
Okay. Again, please make sure that you fill out the survey. Another parent asked, if we choose the agency option in CFC, can the parent be the PASS provider for an adult child? Both parents are not the guardian of the adult child.
Absolutely. Yes.
Okay.
As long as they're over the age of 18, they certainly can be the paid attendant.
Okay. Must a person on the CFC, no, excuse me, must a person on the waiver interest list, must a person be on the waiver interest list to receive CFC?
No, that is not a requirement. They do not have to be on the waiver interest list. However, I train my service coordinators to where they, when they approach a family about CFC and we find that they're not on the interest list, we talk to them about that and we do assist them with getting on the list because we know how
Perfect.
important those waivers are.
And our hope is that, you know, certainly if they're reaching out for community first choice and they're 18 years old, my gosh, we want them on those waiver lists long
Absolutely.
before then.
Absolutely. So yes, we definitely stress that.
What are the maximum number of PASS/HAB that a person can have? And I think they meant hours. Is
Yes,
it just based on level of need?
That's correct. And we get that question a lot because parents kind of want to gauge what they're looking at if they enroll into the CFC program. And unfortunately, we're not able to tell them what that would be. It just
Right.
depends on what the CFC functional assessment yields.
Right.
based on the results. It's based on the person's level of functioning.
Can a parent live in the same home with the client and be paid by the agency if 18 or older?
Yes, they can. As long as they're in CFC non-waiver, yes, they can. Once they enrolled into HCS or Texas Home Living, they can no longer be the paid attendant if they're living in the home with the individual.
Got it. What about an adult sibling living in the same home?
Absolutely.
Yep.
We see that all the time. We have, a person who's 18 or older and they have an older adult brother or sister that lives there and mom or dad relies on that sibling. So absolutely.
Thank you. With CDS, could the parent/legal guardian be paid and someone else in the household be the CDS employer?
Yes, they can. As long as it's not the paid attendant.
Should the MCO, that's managed care organization, not for you, but for other people, should the MCO service coordinator tell their clients about CFC if they know that they have a disability?
They absolutely should.
But are they remains to be seen. I can tell you, and Kenyonika knows everyone, when I got CFC, I was given so much misinformation, not by the Harris Center, but by my managed care organization.
Yeah, and we see that on our end too. And unfortunately, I think just my assumption is because they maybe have a lot of turnover. So it may be training issues with them.
Exactly.
Yeah.
Once someone expresses interest in CFC, about how long should it take to receive services?
That's a great question. I knew that one would come up. So if a person already has a DID in place, our performance contract basically says that we have 75 days to get that person enrolled into services.
Okay.
My experience has been that it usually takes us roughly about 60 days.
Okay.
Sometimes it's more, sometimes it's less. It all depends on the family schedule, how quickly they select a provider, how quickly we can get the CFC functional assessment completed, and things like that. So just depends on how it works out, because remember, there's 2 meetings that have to take place.
Right. And we already talked about that the attendant is allowed to transport the client. So we already discussed that yes, they indeed are. It's just they can't bill for it.
Correct.
If the parent is the attendant or someone 18 or over through an agency, can the parent transport the individual? Sure.
Yes, absolutely.
Next question. Is CFC limited to residents who live in Harris County? No, it is not. Community First Choice is for everyone in all counties. So please make sure that if you don't live in Harris County, that you reach out to your local LIDA. If you're not sure who that is, please reach out to Family Network and we will find out, or you can Google who is my LIDA in Texas, and it'll bring up every one of them. Thank you so much, Kenyonika. Great information, Kenyonika. How would this work if approved for MDCP respite only currently? I'm not sure I understand that question. Maybe you do?
Not totally.
Okay, so to the person who sent that question, how would this work if approved for MDCP respite only currently? Please email me or email Kenyonika. She gave her email address, and ask that question to her, because we don't want.
I would add, Judy, also that we don't enroll individuals that are in the MDCP program. So it's likely, I don't mind assisting or anything like that, but it's likely that their question may be best answered by their MCO, because that's where that gets authorized through.
By your managed care organization. Got it.
Correct.
The AmeriGroup, the United.
Molina, yes.
Yeah, okay. Eric and Heather asked a great question. What would Community First Choice services look like for a minor? So, and if you want, I'd like to try to answer part of this. So the way the process works is there's going to be an evaluation. And once it's determined that your child is eligible for Community First Choice, they're going to ask, can your child bathe himself, dress himself, feed himself, depending on his age, prepare simple meals, things like that. Maybe it's help with social skills, maybe it's help with homework, different things. Am I correct, Kenyonika?
You're absolutely correct.
Okay, it's based on what your child needs. So that evaluation that takes place in order to determine the level of services that are needed, you're talking, like she said, 20 pages. They ask everything that your child can do. I mean, can they button shirts? Can they zip jeans? Can they, simple tasks? Can they follow directions? Things like that. And these are things that the attendant can work on. Next question. Okay, Harris County, we answered that. So Leslie, you wrote something about generally someone on MDCP transitions to the STAR Plus waiver at 21, correct? Yeah. Oh, thank you, Laura. Kenyonika, great job. How can you have CFC and be using the waiver program like class or HCS? That I can't answer because I'm on the never ending wait list.
So my understanding, and I'm not very familiar with class because we don't authorize class here at the LITA,
Right.
but with HCS, it's one of the residential components now. So it used to be called supported home living services under HCS, where a person has their own apartment, they live in their own home or the family home, and they have someone that comes in and help with those skills. So it's basically renaming that residential component, the supported home living component, to community first choice now. That's essentially what it is.
Got it.
And my guess is that under the class, it's probably very similar.
Very good. Just to confirm, you can't utilize MDCP and CFC at the same time? That would be.
So it's my understanding that MDCP does offer CFC-like services. It may not necessarily be called CFC, but there is some component of attendant care services that could potentially be requested under MDCP.
Is there a max number of hours? Yeah, it depends on the assessment as to how many hours somebody's going to get.
Correct.
So there's no maximum at all. So if the person needs a large number of hours, there's no cutoff.
Well, I will be transparent in letting you know that the MCOs certainly have a cutoff. They haven't published or verbalized what their cutoff is, but it's completely left up to them and their review of the assessment as to how many hours are going to be authorized. So that's pretty much how it works. But I can't say that I've seen or I've received information from an MCO that says, hey, we can't authorize this because it goes over the max. It all depends on that functional assessment.
For transparency, and Kenyonika, you may not know the answer to this. Are the CFC funds 100% federal funds without Texas matching funds? If so, isn't the CFC program due to the federal government rather than a Texas program responding to the Texas legislature? Federal direction is to enhance Medicaid, not take anything away. Therefore, why must families with a waiver choose CFC or another program? Keep in mind, and correct me if I'm wrong, Kenyonika, CFC is while your families are waiting for Texas Home Living and HCS and class, correct?
That is correct.
Okay, so we're not asking to choose one or the other. CFC
Wait. No, because if you look at if you have HCS or class, your attendant care is going to show CFC. It's all where the funds come from. So for instance, Cameron's attendant care hours, which he's on class, are funded through CFC, not the CFC that Kenyonika is talking about today, but the CFC that's on the waivers. So once CFC came into being, that portion of Cameron's budget switched over from what it was before a Texas funding to a federal funding. And I believe it's the same for HCS. I think that's what Mary Jane told me.
Okay. Okay. Thank you, Leslie. Do you know about federal funds versus Texas matching funds, Kenyonika? And if you don't, that's okay.
I do not. I have to be brutally honest. I do
Okay.
not.
Okay. To Anne, if you want to know, I would maybe ask Bob Stakem. He might know. Can we get Kenyonika's email address again? Kenyonika, if you could type that in the chat box, that would be great.
I sure will.
Luce asked, how much help can they get with schoolwork? You know, again, an assessment has to be made. Attendants aren't teachers, but I'm sure they can certainly assist. I doubt that they can assist with certain things, but other things. Kenyonika, what are your thoughts on that?
I would agree on that. And again, I mean, I know I keep sounding like a broken record, but it depends on the functional assessment and how the MCO looks at it, whether they're approving so many hours for assistance with homework or other tasks like that.
Okay, thank you. Lots of compliments. Please make sure that you all fill out the survey to the person. Oh, no, I already got their name. Okay. I think I covered everyone's question. If I did not, Suresh, did you get your question answered? Suresh? Okay, I'm hoping that we did. Any other questions that anyone has? Lots of compliments, Kenyonika. Thank you, thank you, thank you. This is a lot of information. Kenyonika has to explain it to me multiple times.
That's okay. I have to explain it to myself multiple times.
I'm sure you do. I'm sure you do. Many, many thanks to all of you. If you would like a recording, Kenyonika, a gentle reminder to please send me the PDF slides.
Sure.
For this, for anyone who would like the recording and or slides, please email me and I will get those to you by the end of the week. Thank you all so much for joining us. I am so happy that we had this presentation today. Very, very beneficial. Coming up in 2 weeks, a lot of issues surrounding dental care for our population. Parents believe that their children need to be sedated. Parents believe that their adults need to be sedated in order to receive dental care. We have Dr. David Frey from the UT School of Dentistry, who is a professor. He is going to explain to us about building a trusted relationship with your dentist. Really, really important information. We hope that you join us. I will be sending out emails with the flyer, and you can also go to our website, familytofamilynetwork.org, for this information. Thank you so much, Kenyonika. Leslie, I think you're still on. Thank you so much for your input on this. Because my son is not on the waiver yet, thank you, Leslie, because there is so much information and it is so confusing. Kenyonika, you continue to be the CFC queen.
I'll try.
And
Thank you for having me, Judy. This is a great opportunity.
My pleasure. My pleasure. Thank you all so much. Have a great day. Thank you.
Bye, everyone.
Don't forget the survey. Bye-bye.
Thank you.